Hi, good morning. My name is Albert. I'm a student nurse at Nevada State College, and I will be performing your exam today. How are you?
I'm good, thank you.
Great. And what is your name, please?
Natalie Bose.
And how do you prefer to be addressed?
Just Natalie's fine.
Okay, Natalie, terrific. So what we'll be doing today is we'll be videotaping an exam for my course, my physical assessment course.
Okay.
The results of the exam will only be seen by my instructor, and they'll be deleted afterwards.
Okay.
And I'll be asking you questions during the examination, but I'll also be doing some talking, reporting your findings out loud so that my instructor can hear this. If you have any questions at any time during the exam, I want you to ask me, okay? And do you have anything before we begin?
No.
Okay, I'm going to come over here and get some hand gel because we want to do hand hygiene. It's very important. I want to make sure I'm not passing any bugs on to you.
Thank you.
No problem. Let's place that up there. And I think I used a little too much. I always do. All right. And what we'll do is we'll simulate me pulling a curtain around because we want to maintain your privacy and your dignity.
Okay.
And also want to make you feel safe. All right. So first off, I'd like you to please tell me your full name.
Natalie Bose.
All right. And what is your date of birth, please?
9/15/1982.
All right. And that makes you how old?
32.
Terrific. Now, I want to talk a little bit about your medical history. Do you have any history of any ongoing chronic diseases?
No.
Okay. Do you have any history of any type of trauma where you've broken anything, had an injury that needed to be treated?
2 where I've needed stitches above my eye and in my right leg.
And when did those occur?
When I was really young.
Okay, so during childhood?
Yeah.
Okay. And have you had any history of any surgeries?
Surgeries, I had my vein stripping in my left leg in 2011, and I had my wisdom teeth removed back in 2002.
Okay, terrific. Excuse me. Do you smoke at all?
No.
Good. Do you drink alcohol?
No.
All right. And are you taking any illegal or street drugs?
No.
Okay. Are you currently taking any medications?
No.
And do you have any drug allergies?
Not that I know.
Any food allergies?
No.
Any environmental allergies, dust, pollen, things in your workplace?
Just the seasonal allergies
Okay.
that come out during mostly the spring.
Okay. And do you exercise on a regular basis or at all? Or?
No, I don't exercise, but I have a physically demanding job, which I feel is enough for me.
Okay. All right. And so are you physically active in any other time other than your job?
At home, I'm constantly busy and working, cleaning, and just always moving.
Okay. Tell me a little bit about your job. You say you're physically active.
Yes. I work in a warehouse, so I'm lifting boxes constantly and, you know, bending, but they stress safety and good work habits, so.
Okay. All right. Terrific. So now here's the part where I'm going to start talking so I can tell the camera my findings. So you appear your stated age. Just looking at your skin here without having you disrobed, you look like it's uniform. It's in line with what I'd expect. And what is your genetic, racial background?
Caucasian.
Okay, and that's exactly what I would expect here. Just some white skin, a little tanning in areas that looks like you get a little more sun at. So that looks good. Your speech is clear and articulate, which is good. Your posture is erect. Your position, you look like you're sitting, you're very comfortable. You are awake, alert, and oriented. You're responding to me appropriately. Your mood is responding to me appropriately. You're responding appropriately to the questions. Your affect is good. Normally, you know, you're not like a flat affect or all over the place, which is a good thing.
Good.
So I don't see anything abnormal there. So what we'll do now is we'll look at your skin. It appears that it is warm, dry, and intact. And I'm going to pinch there. And that's good turgor. And what turgor is that's just your skin, how it bounces back. If you were dehydrated, it would stay up like that.
Oh, okay.
Okay. So I don't see any scars or lesions. Even right there, I don't see anything there on your eyes, which is good. I don't see, there's a little bit of breaking out around your face. That looks good. Has that been a problem for you?
Yeah, most of my life I've always had acne, especially in my chin area.
Okay, and how do you treat that?
Just by washing my face, and that's all. I don't really put some sometimes some cream.
Okay. Do you wear sunscreen when you're outside?
I have a bad habit of not putting it on.
Okay. All right. Let's see here. Would you take your glasses off for me for a minute? I just wanted to see here. All right. So your eyes look symmetrical. Your ears look symmetrical. Nose is midline. That's a good thing. I don't see any issues here with the mouth. Overall, you have a very good symmetrical body position. I don't see anything which looks different markedly than the others. So that's a good thing. So right now we'll go ahead and start. Let's see, I'm gonna look at your hair. Okay, good. This is good, fine, even distribution, which is what we want. I'm gonna palpate your skull just to make sure there's no issues here. Okay, good. All right, excellent. And your skull is what we would call normal cephalic, which is just a normally shaped skull. You don't have an usually large or small head.
Okay.
Okay. Just gonna kind of press here. Any tenderness there at all?
No.
Okay, good. Anything there?
No.
All right, wonderful. So now we're going to go ahead and we're going to take a look at your eyes. And just looking at your eyes, I don't see any kind of swelling or edema. I don't see any type of lid drop or drooping, what we call ptosis. You look like they're nice and round in terms of the shape of your orbit and your eyelids and your lower eye. Looking at your conjunctiva, it looks clear, so it should be pink on the bottom and white on the top, which it is. Your sclera, which is the white part of your eye, that looks white like it should. Your iris looks flat, round, even. Your pupils, they look round, regular, and equal to me right now. I'm going to go and get a light here. Okay. I'm going to shine that in your eyes. It's going to be a little bright, so I'll apologize in advance. So I want you to look straight. Okay, good. And your pupils are contracting equally, which is what we want. And so you have what's called perla, where your pupils are equal, round and reactive to light. And then we're going to check your accommodation right now. So I want you to look at this pen, focus on the pen. Perfect. So did you notice how your eyes crossed there?
Yeah.
That's the accommodation part. Okay. And if your eyes didn't do that, that would be an issue.
Okay.
Okay. So terrific. So eyes are looking good. Let's go ahead and we'll take a look at your ears. All right, then we'll move on from there. So from here, I'm going to use my otoscope, and we're going to take a look in there. But first, I just want to look, okay, your ears appear to be the same skin color as the rest of your body. They're a little red, so I'm guessing that maybe from you being in the sun, not wearing a hat. Do you pay attention to your ears when you put sunscreen on? Okay, you probably should start, okay? Now this part here, this is called your pinna, and we're going to pull it back. Does that hurt at all?
No.
Okay, I'm going to press on this part. It's called your tragus. Does that hurt?
No.
All right. We're going to do the same thing on this side. We're going to retract your pinna. Anything?
No.
Push on your tragus.
No.
Anything? Okay. I want you to turn so you're facing this way for me, just so I can look at your ear canal. All right. If I can get the otoscope to work. There we go. All right. So right now we're looking inside. Okay. The canal is clear. Little tiny amount of cerumen. It is pink. There's no redness. Looking back to your tympanic membrane, that's that area there that separates your ear from the rest of the inside of your head. Pearly gray. I don't see any perforation. I don't see any drainage buildup behind there. Look at your other ear. Let's go ahead and let's look at the other ear. Okay. Same thing here. Canal looks great. No cerumen or wax. Tympanic membrane, again, pearly gray. Not seeing any kind of perforation or fluid behind there. Looks wonderful. All right. So we've checked out your eyes and ears. Now I'd like to go ahead and take a look at your nose. So what we'll do is I want to just take a look up there real quick. Okay. Your nares appear patent, pink. There's no redness or swelling that I can see. Okay. I want you just to look at me. Sniff. Sniff in. There we go. Good. Sniff in again. Excellent. So that's checking the patency of your nares, the openness, okay? Now I'd like to, normally we don't test your sense of smell, but for the purposes of this exam, my instructor would like you to test that, and that's for cranial nerve 1. So I'm going to run and get a couple different things. I want you to keep your eyes closed, and then when I ask you to sniff, you take a sniff and you can describe it for me. Sweet, sour, you know, whatever comes to mind. You don't have to identify what it is, just the smell. Okay? Items here. Okay, eyes are closed, good. Smell that for me.
Smells sour.
Smells sour.
Mm-hmm.
Okay. All right.
Oh, I don't know what it is, but it's sour. Sour.
Sour. Okay.
Like a vinegar?
Yeah, that was it. Yeah,
Oh.
that was it.
Yeah.
Okay. Smell this for me. What would you say that smells like?
It's sweet.
Okay. Excellent. Good. You passed. So just for your information, I would like to tell you that. Just for your information, I'd like to tell you that I tested you on Italian dressing, which I was hoping would be a little sweeter, but it wasn't. I think I grabbed the wrong dressing, vinegar and ketchup. So your sense of smell is very intact.
Okay.
So wonderful. So you passed that test. Your cranial nerve 1 is working. So now I want to look at your lips, and they look a little dry. There's a little bit of cracking there, but I don't see any type of lesions. Open up your mouth for me. Look at your gums. Okay, good. Your gums are pinkish white. There's some good, well-defined margins. I don't see any lesions. Terrific. Looking good. Your teeth are all white. They look like they're well formed, and you said you're only missing your wisdom teeth, but I don't see any other missing or chipped or cracked teeth.
Yeah.
Stick out your tongue for me, please. Good. Your tongue is midline, and I don't see any fissures. It's moist. Looks good in there. Now we're going to look up inside what we call your mucosa and your buccal mucosa, which is the inside of your mouth. Okay, good. Hard palate is white, soft palate is pink. Again, no lesions. Okay. Now do me a favor, I want you to go Okay, good. And I looked at the back of your throat. I don't see any redness or exudate or swelling, anything of that nature. And I was testing, when I had you say I was testing your cranial nerve 7. No, I'm sorry. I was testing nerve 9 and 10, I believe. Okay? So that looks good. So now I'd like to go ahead and I'd like to test just to kind of feel for your neck. Just relax. Okay? Feels good. Now I want you to bring your neck down for me. Okay? Bring your neck back up to a straight position. Go back. Good. Bring it back to a neutral position, please. Turn to the left.
Oh,
Good.
my left.
Yeah,
Sorry.
your left, your right. Good. Okay, neutral position, down. Good. Up. Now back. Okay, excellent. Now what I'm going to do now is I want to palpate your lymph nodes, just to make sure there's no swelling, because what can happen is when you get sick, those nodes get swollen because they're collecting the bacteria and whatever's making you sick. All right? So got your preauricular, your postauricular, your jugulodigestic, submandibular, submental. We're going down your cervical chain, checking posteriorly as well. Coming down to your subclavicular. Okay, I don't feel anything unusual there. What I would like to do though is I also do want to listen to the arteries there on each side of your neck, the carotid arteries, and we're listening for a bruit, which would be a whoosh, whoosh, whoosh. That's bad. Good. Okay. I heard exactly what I was supposed to hear, which is wonderful. Now we're going to go ahead and we are going to listen to your lungs. So what I'd like you to do for me is, I'd like you just to turn a bit here, just so I can, there we go. Now I'm checking for bilateral expansion when you breathe in, okay? So take a good deep breath for me. Excellent, good bilateral expansion. We have good contour. We have a good A to P ratio. I don't see anything abnormal there. Now I'm going to go listen to your lungs. Deep breath. Good. And again. Excellent. Wonderful lung sound so far. Again. Good. Deep breath in. Again. again. And again. Again. Okay, and again. All right. I'm hearing completely normal lung sounds. There's no crackles, there's no rails, there's no consolidation. Those are all just terms for different things that can change the sounds of your lungs when you're sick or when your lungs aren't performing to 100%. Okay? So what I'd like to do now is I'd like to listen to your heart. That's all right? So we'll go ahead from here. I'm going to listen to the aortic, the pulmonic, herbs, tricuspid, and mitral. Okay, they sound wonderful. I didn't hear any rubs, any murmurs, any unusual heart sounds. I heard both S1 and S2, which is what you want to hear. And to me, they sounded like they were loudest here in the mitral area, where you have the valves in your heart, and that's where you can hear your mitral valve. And that's where it sounded loudest to me.
Okay.
Okay? What I'd like you to do now is I'd like you to lay down for me. I'd like to do an abdominal exam.
Okay.
So go ahead and lay flat here, head here, feet here, if that's all right with you. Okay. Wonderful. Now what I'll do is we'll go ahead and I'm just going to expose some of your stomach. Is that all right?
Yeah.
Because I have to be able to observe it. Okay. All right. I would call the contour of your stomach flat. There's several things that could be rounded is also normal. Flat's fine. Protuberance, where you see those commercials where the stomach's just huge, that's generally not good.
Okay.
All right. And what I'm also going to do is I'm going to check for symmetry. So I'm just going to shine a light across your stomach just to see if I can make sure it's symmetrical. Okay. Okay. And it does look symmetrical. I am noting that you do have what we call some striae here, some scarring. Do you have children?
Yes, 3 of them.
Okay, and that's perfectly normal, as I'm sure your doctor's explained to you.
Yes.
Okay. What I'd like to do now, though, before we continue, is I did forget to listen to your apical heart rate, which is another way of checking your pulse. So we'll bring your stomach down for now, because I can listen to it while you're laying down. Keep your hands at your sides. I'm going to go ahead and I'm going to bring my clock here, which I'm just using my phone as a stopwatch. I'm going to hit that timer so I can listen to it for 60 seconds. Okay, let's get over here first. And we're going to hit start. Okay, so your apical heart rate, which is pretty much the most accurate measurement we can get of your heart rate without using a machine, was 57, which is a good slow rate, and you can see that all I did was stop the clock. I'm going to hit reset, and I'm going to set the phone down. Okay, if I can find the reset. Oh, I'm just going to turn this off. Oops, sorry. So, good apical heart rate. So I'd like to get back to your stomach if that's okay.
Yeah.
So where we left off is I just basically took a visual view of your stomach, noticed that you did have that striae, that stretching there from giving birth to your wonderful children. And now I'm going to listen for your bowel sounds.
Okay.
So basically, do you ever sit around and you just feel your stomach gurgling?
Yeah.
That's what we want to hear, because that means that your stomach and your bowels and your abdomen are working.
Okay.
So we're going to listen in 4 areas or 4 quadrants. Excellent. Good. I heard bowel sounds in all your quadrants, which is a good thing. Now what I'm going to do what's known as percussion. Okay? We're just listening for kind of a dull sound. Okay? So we heard what was known as timpani, which is that sound that we want. It's not the dull sound. The timpani is just the thumping there.
Okay.
And if there was some dullness, then there might be maybe some extra gas or something going on with your belly. But we're fine now. So what we're going to do now is I'm going to do some light palpation to see if there's any kind of enlargement in any of your stomach organs. We'll just do something really light in all 4 quadrants. Okay. Now I'm going to do it a little firmer. This is going to be deep palpation. You may feel a little more uncomfortable. If you do, please let me know.
Okay.
And I apologize in advance. Okay. I'm going to feel back here and see if I can feel your kidneys, which I doubt I'm going to, which is a good thing. Okay, don't feel anything there at all. Okay, wonderful. So none of your organs are enlarged. I'll have you sit up for me, please. Because what I'm going to do now is we're going to check for what's known as costovertebral angle tenderness. Okay? So I'm going to come around here and I'm going to place my hand on your back and just give it a little thump, okay? And all it should feel is a thump and not pain.
Yeah.
There should just be a thumping and nothing should be moving. Okay, wonderful. Excellent. Now I would like you to just come on over here. You can stay wherever you're at. We're going to do some musculoskeletal testing. Okay? So the first thing I'd like you to do is let's test your reflexes. I'm going to hold your arm up here. Just relax. Just let it hang. Just let it hang. Okay. Just relax. Relax your arm. Okay. Now what we'll do here is we'll test here. Good. Good. Sorry, I know. You have to give a little bit of a thump there. So what we'll do next is I want you to squeeze my fingers as hard as you can. Good, hard. Pull against me. Pull, you pull. There we go. Okay, wonderful. Now, bring your hands underneath mine. Push up. Good. Push down. Excellent. Push out. No, just bring it like this. Push out. There we go. Push in. Excellent. All right. Lay down for me. We're going to do the same thing here real quick to test. Well, before we do that, let's test your biceps. Did forget to do that bicep test. Just relax. Relax your arm. Good. All right. Now go and lay down for me. You want to test your feet. Feet at this in, please. Okay. Push for me. Pull. Okay. Push out. Good. Push in. Excellent. Okay. Now, real quick, we're going to check some pulses here. I didn't do that before, but I do want to do that now. I'm going to take off your socks if you don't mind.
Go ahead.
Thank you. It's going to just make it easier for me to check your pulses. First ones here are your dorsalis pedis. And we're going to check behind your ankles, which is your posterior tibial. And then finally, we're going to check your radial pulses here, just in your wrist. You can just lay down and relax there. Excellent. Okay, I want you to stand up for me, please, if you don't mind. Okay, I'd like you to bend over and touch your toes. And, okay, when you do that, I'm just going to take a look at your spine. Okay, all right. Symmetrical. I don't see any kind of bulging. Stand up for me. No issues with the spine. Now what I'd like you to do is I'd just like you to walk to about 10 feet back for me, okay? I just want to observe your gait. Okay, looks good. Come on back for me. Okay, excellent. Have a seat for me, please. So that concludes our exam. Do you have any questions for me at all?
Am I overall pretty healthy, or?
Yeah, overall, I did not find anything abnormal about you whatsoever. So, had a very good physical exam, and nothing really unusual to report. The only thing that I did want to talk to you about that I forgot to mention is, could you just tell me what you had for breakfast this morning?
I don't remember having breakfast.
I see, okay. What did you have for lunch?
I had a chicken sandwich.
Okay, and what did you have to drink?
An iced tea.
Okay, did you have anything to drink throughout the day? Water, any other sodas, drinks?
I think I don't drink enough because my lips are so dry.
Okay, and what did you have for dinner?
I had meatloaf.
Okay, all right, terrific. All right, that was the one question I wanted to just cover with your nutrition a little bit. So I would just say, try and drink more water.
Yeah.
As far as your physical activity at work and at home, you really want to make sure you're safe and follow your work instructions as far as, did they talk about body mechanics?
Yes.
Okay, make sure you're following those proper body mechanics at work and home.
Okay.
Okay, and that about covers it. Do you have any questions for me at all?
No.
All right, well, thank you so much for your time.
Thank you very much.
Have a wonderful day.